Hi, everybody. I'm Dr. Richard Stevenson, and welcome to 5 Things You Should Know About X. And X is dental topics. We have dental topics ranging from endodontics, oral surgery, implantology, veneers, etc. And our channel is here to help patients make better decisions when you go to your dentist. I'm really pleased to have our guest today, who is Dr. Joan P. Anfrans. Hi, Joan. Good to see you, bud.
How are you?
We are old friends. He's my surgeon for all of my implant cases here at the Teaching Center in San Dimas, and he is an expert implantologist. And before we get into the topic about implantology, let's talk a little bit about what's happening with implants in the United States. Well, first of all, you may not know this, but 36 million Americans have no teeth. 36 million. It's unbelievable.
It's
just striking. Yeah, and 120 million Americans are missing at least one single tooth. 120 million Americans. That's approximately 1/3 of Americans are missing one tooth. The implant industry has grown to over $1 billion industry in this country, just implants itself. That's just mind-boggling. It's basically surpassed all other industries in dentistry. And it doesn't continue to slow down. I mean, when it started in the early 1990s, actually it started in the 1980s, late 80s, mid to late 80s, but in about the 1990s, only about 1% of people were even performing implants. And now it's grown dramatically, and that number is much, much, much higher. Another interesting thing about implants, and it's a confusing thing, particularly for patients, is 1/3 of all implants are placed by general dentists, and that did not always used to be the case. And I wanted to kind of delve into a little bit about some of the decision making that you're going to want to make before you get to the dentist to get the right implant for the right reason. And our guest today is Dr. Joan P. Anfrans. He is originally from Spain. He was trained in New York in implantology. He came to UCLA. He went through an extensive implant training program there for many years, and actually became a faculty member at UCLA. He's trained under some of the greatest implantologists in the world, and he is an expert surgeon and serves all of our patients here in our San Dimas Teaching Center. And also, I'm pleased to say that Joan and I have taught many courses together at UCLA and now here at our Teaching Center. So is there something I missed about your amazing credentials?
You did pretty good, thank you.
Nice. Well, it's really good to have you here. So I'm gonna go ahead and challenge you a little bit with some questions. And these are things I think that every patient should really know, right? And the first one is, implant success is variable. Implant success is variable. And smoking and diabetes are the biggest risk factors. Does that statement ring true to you?
Correct, yeah. Generally speaking, we can say that dental implants are about 96 to 98% successful. That's in normal, healthy patients. But there are certain medical conditions and habits that can certainly bring down that success rate to close to 10 points below the normal standards. And diabetes and smoking are probably two of the biggest reasons why dental implants could have some problems. Diabetes has an effect on wound healing and bone metabolism and bone healing. And so patients that suffer from uncontrolled diabetes especially, can certainly have a lower success rate. These are patients that are perhaps more prone to developing infections around dental implants. And smoking is the other big one. Smoking affects dental implants by affecting the blood flow around the area, both in the soft tissue and in bone. And so these are two things that we always worry about when dealing with patients is diabetes and smoking. These are probably two of the biggest issues that we see in dental implants today.
Yeah, I was thinking, is there anything a patient can do if they are diabetic and they are a smoker to better their healing rates and their chances of success in the implant world?
Yeah, definitely. Especially in diabetes, we want to make sure that the diabetes is well managed and under control. Unfortunately, we see a lot of patients that are what we call borderline diabetes, which means that they go up and down. They're not very well controlled. Their sugar levels spike. And these are patients that are at very high risk of developing infections and problems around dental implants. On the other hand, smoking, we always encourage our smoking patients to try and quit smoking
Right.
prior to surgery, and we've actually been quite successful with that in some patients. Patients are going to make a significant investment both in time and money, and so for some patients that is a good reason to quit smoking, and we've successfully been able to do that in some patients.
That's really helpful. So a patient that has both diabetes and smoking, or either one of those, can improve their implant success rates just simply by changing some of their
Correct,
habits,
yeah.
or maybe some of their medications, or their eating habits and things like that. But what about vaping? I mean, isn't that okay?
Yeah, that's a big that's a big question right now. Vaping is seem to be considered as the healthy way of smoking, and in fact, what vaping does is it has high concentrations of nicotine, which is one of the components in tobacco that is harmful for dental implants. And so in these e-cigarettes, the nicotine concentration is exponentially higher than in a cigarette. And there's a lot of other chemicals that we don't even know really what the effects are yet on dental implants. We do know that there's a lot of research happening around e-cigarettes and vaping, especially at UCLA. And so we're always following very closely that research to see if there's any new developments in that area.
Nice. Well, it's really helpful information that the patient can actually do something for the team, if you will, by improving their success rates.
Correct.
I mean, a lot of patients believe that it's all about the doctor's ability, and it's all about, I went to a good doctor, they took care of it for me. Well, and you are a great doctor.
Although that is
but-
important, patient factors are extremely important as well.
But I mean, it's kind of cool that the patient actually can take some positive steps to improve their chances of success, which is really awesome. There are a lot of, I'm driving on the LA freeways, and if you're not from LA, that means something to Los Angelinos. It means you're going to be on the freeways a lot. And one of the signs I see, one of these billboards, is implants for some dollar
$3.99.
amount. Right,
It's usually
$3.99. So my next question is, and this is a statement, I want you to just tell me if this makes sense. Implant quality is not the same, and manufacturers have different standards. Make sure you ask for the best materials when you receive implants, or at least know the success rate of the brand your dentist is using. How does that sound?
Yeah, I mean, the way that I like to compare it is, for example, let's take gold, for example, right? You
Sure.
have 24 karat gold, you could have 18 karat, 14 karat. There's different levels of purity of that material, up to all the way down to gold plating, for example. Dental implants are made out of titanium, and titanium has different grades as well, from 1 to 5, 5 being the highest grade of titanium. And so most of the well-known reputable brands use the purest form of titanium, which is grade 5. But there are other smaller companies that perhaps don't have the funds to do all the research and develop their products the proper way. And so some of these companies, they're cutting corners by utilizing titanium that is not perhaps to the highest grade. And that's what we see in the industry. We have a lot of smaller companies that are using products that are not necessarily the highest quality. They're still dental implants. They can still integrate in bone, but the quality of the material is not the same, and that therefore can lead to more problems.
So would it be safe to say that you get what you pay for to a certain extent?
Yeah, I think you could say that.
Are there some dental operations that you think might be charging really high fees for implants, and they're cutting corners to try to improve their bottom line? I mean,
I've
is it a
seen
good
that
idea for
happen.
patients to be aware of what they're getting?
Yeah, I've seen that happen, and these infomercials and these billboards are very misleading. I know for a fact that some of these places, they'll offer an implant for $399, but what they don't tell you in the small print is that then they'll charge you $3,000 for a crown, for example. And
I see.
they're gonna make their fee up somehow.
Right.
And typically these are the places that are using materials that are not to the highest standard. So
That's really helpful. I really appreciate that, because for me as a general dentist and doing a lot of restorative dentistry, materials are so critical to our
Absolutely
success,
critical.
and we have to understand the materials. I mean, to a certain extent, I think dentistry has to become like a materials scientist to be a really good dentist. You have to understand all the chemistry and what have you. I wanted to move on to sort of planning and this whole idea about coming in to see a dentist and having a workup done, maybe that's a couple of x-rays, or maybe there's a CBCT, which is, you can talk about, and then they go immediately into implants almost the next day. Is this kind of approach to care a great idea? And here's my statement that you can discuss or disagree with. Proper diagnosis, planning, imaging, which means mainly x-rays, different types, and guides are essential for the best results, and recommending that patients should have numerous visits in the planning phase before the implant is actually placed. Does that make sense, generally speaking?
That's absolutely true. I mean, planning is the key to success. Not only planning, but everything will start with the proper diagnosis and evaluation of the patient, review of the medical history, review of the medications. We know that there's a lot of medications that can have an effect on bone metabolism, bone healing, wound healing in general. And so those are the first key steps that we cannot skip through. Good diagnosis, good review of the medical history, and then planning the case adequately is absolutely a fundamental thing in implant dentistry. And we can do that today utilizing a lot of the technology that is available to us, like CBCT, three-dimensional x-rays.
Wait, hang on. CBCT, that means cone beam?
Cone beam computerized tomography.
Okay, so this is a sort of like an x-ray that will take...
It's a specialized, we could say that it's a specialized three-dimensional x-ray that makes slices on the jaw bones, and then we can upload that information into a computer, and we actually have some computer planning softwares that can allow us to do a virtual surgery on the computer before we even do the surgery on the patient.
That's amazing.
That allows us to choose the right size of implants, the right components, can give us an idea of any anatomical variations or limitations that we could encounter in these cases.
Yeah, I was going to ask you, if a dentist has made the decision to utilize this digital technology to plan, to virtually place the implant before they actually place the implant, to have these plastic guides made that tell them exactly where to drill, does that guarantee success in the implants?
It does not guarantee success, but it can certainly improve the chances of success. The more you plan, the better prepared you are before proceeding with the case, the more chances that the case will be successful. So certainly, all of the computer technology that we have available to us today really helps us in minimizing the complications that can arise from implant surgery.
Yeah, I mean, I was thinking about, as a patient again, what would I want to see from my dentist if I were a patient? And I'm thinking, I'd want to see that implant planned before it was actually placed. In other words, I'd like to see a three-dimensional model either on a screen or in something I can handhold, and see that the implant is going in a certain location, and hear the doctor talk to me about how important it is to get the right angles. Absolutely. And where the bone is, things like that. And I think that patients really have a right to know that information.
Yeah, absolutely.
I mean, as a patient receiving an implant, I would want to know exactly how that was going to be done and what thought process went on in your brain before you decide to put something metal in my body that's going to hopefully last a lifetime.
Correct. And as you know, that's what we teach at UCLA. I mean,
that's right.
Our students go through extensive treatment planning sessions, and they learn how to diagnose and utilize all the computer technology.
That's absolutely right. And I'd like to say also, plug, that's what we do here at Stevens Dental Solutions. We absolutely teach our dentists to be amazing, which beautifully leads into the next point, which is training. Training is really important. Would it be okay to ask your dentist where they received their training? Is that a fair question?
I think so.
Does it matter?
It absolutely matters. I think that patients should be able to ask where a practitioner has completed their specialty training, if any at all. Well,
wait a minute. Why don't I just go ahead and go to, I can take a 4-day course overseas.
Sure.
And I can place 30 implants and I can come back. I mean, I've got 30 implants under my belt. Come on. Am I not at the right level?
It's not about quantity, it's about quality.
Okay, so what does that mean?
Well, generally speaking, these fast track courses will just show you how to drill a hole and plug it with an implant.
Right.
They don't necessarily review things like diagnosis, true implanting, proper surgical technique, what happens when there's complications, how to manage complications, how to properly place the implant, how do we plan an implant.
Right. So like if I'm there for a week and I place a lot of implants and if something goes wrong with that implant, I'm already home. I got off the plane.
Yeah.
I don't even know if that's happened.
As far as you're concerned, that implant was successful.
Right. We call that a geographic success, right? So I was thinking, do you have a kind of in your mind an idea of what length of time, what span of time would be appropriate for a dentist to learn how to place implants at the best, at the highest level?
Yeah, implant dentistry has changed a lot. At the beginning, when dental implants were first introduced, it was only reserved for oral surgeons. They were the only people that were allowed to train how to place implants.
So the manufacturers restricted that.
Yeah, exactly.
Okay.
Obviously, now we're in different times. We have general dentists placing implants, but there's really good training programs that you could follow to make sure that you achieve the highest standards of training. Generally speaking, a 2-year program in implant dentistry will give you good basic fundamental knowledge on how to plan, how to execute, and how to follow up with your implants. But we do see, unfortunately, a lot of weekend courses, a lot of week or 2-week courses abroad. They they take you to a tropical island and you place implants for about a week.
Sounds fun.
It
At least
sounds
half
like
of it
fun.
sounds fun.
Sounds like fun, but you're not really getting much out of that
Interesting.
experience.
Yeah, and I as a consumer, patients should feel okay about asking about the dentist training and don't feel that this is a taboo question. And if your dentist is offended by the question, you might want to think about getting another opinion. Because if a patient ever asks me about my training, I am full disclosure, and I think everyone needs to know exactly what we are able to do and what we're not able to do. I hear this all the time in these radio commercials. Implants are just like your normal teeth. They're just the same. And I heard once a really wise dentist said once to me, no, implants are not replacements for teeth. They're replacements for not having teeth. In other words, they're
correct.
Right. I mean, Can you talk about that a little bit? I mean, what can we expect about what should a patient feel when they have implants in their mouth? What are the differences? What do they need to be prepared for when things don't always work out well?
We need to understand that, as you well said, implants do not behave like teeth. We use them to replace missing teeth, but a tooth is very different than an implant.
Well, what's one of the ways it's different?
Well, for example, a tooth has a natural shock absorber called the periodontal ligament, and when we're biting, when we're chewing, if we chew too hard, it's gonna give us feedback and say, "Oh, that hurt. I shouldn't do that." Dental implants don't have that feedback, and so a lot of times we could see patients that will bite too hard, or we can see the occlusion being too hard on these implants, and that can lead to problems. So that's one of the biggest differences, that we don't have a sensory feedback from dental implants like we see with natural teeth.
I heard someone say that if a tooth is exquisitely sensitive because it has a nerve, it has a ligament that gives you all this feedback, but when you extract a tooth, the nerve is gone, the ligament's gone, and the bone heals, and then the bone is not really designed to have a lot of nerve endings in it. It's essentially not a lot of sensory feedback.
There's no feedback on it.
Wow.
And so that's why we see, sometimes patients, like I mentioned earlier, we can have a lot of problems are derived from the biting forces being too harsh on the implants, because we have no way to know whether we're biting too hard or not. And so problems derive from heavy occlusion or too much biting forces or grinding forces on the implants. That's something that we see commonly, and we need to address.
Yeah, and I was thinking about maintenance, about hygiene. Okay, let's say I've just done a really bad job keeping my teeth clean. I've done a really miserable job. I hate going to the dentist. I don't like to get work done. And I find myself 25, 30 years down the road having a lot of teeth that need to be removed. I mean, it's embarrassing. I feel really guilty about it. It's kind of one of those things that has always bothered me. I have sleepless nights about my rotten teeth. And I go to the dentist and have them taken out, and I get implants. Is it fair to say I don't have to worry about my teeth anymore?
Absolutely not.
That's unfair.
Quite the contrary.
Wait a minute.
Actually.
I thought implants are for life. You said 98%.
They have the potential to last a lifetime, but they don't come without complications. And hygiene is an extremely important aspect of implant dentistry. In your scenario, let's say that we placed implants because you had rotten teeth. That's because your oral hygiene probably wasn't very good to begin with.
Guilty as charged.
So what are the chances that patient is going to be good with his hygiene when dental implants are placed.
That's a good point.
Yeah, right. So chances are that they're probably not going to take care of their implants as well. And patients should know that it is much more difficult to clean around a dental implant compared to a natural tooth. The dental implant has a very intricate anatomy, and the tools that we have available to us are not really designed to clean around those implants. And so you need to spend a considerable amount of time every day cleaning around those implants. And so if you were already not used to doing that when you had teeth,
right,
chances are that you're not going to be able to do it when implants go in. And so that's something that we need to consider also when we're planning implants on patients, because
am I going to take care of them?
Well, if I have a sense that you're not going to be able to take care of them, I may not want to place implants on
Well, we can talk. Maybe I can change.
We'll see. It's up for discussion.
All right, very good. First of all, your health matters. Make sure you understand the importance of controlling your diabetes and quitting smoking. Other health concerns are also important. Make sure you ask your dentist how this impacts your success. 2. Not all implants are the same. There are various different manufacturers of implants. Some of them use the best materials in the world. Others, not entirely true. Make sure you know what you're having placed in your body. Number 3. Planning is key. Your dentist should be utilizing the most innovative, up-to-date technology possible, including 3D imaging and guides that help the dentist place the implant in the correct position. 4. Don't be afraid to ask your dentist about their training. Dentists have various levels of understanding about the intricacies of implants. To make them successful, they need to have gone through significant academic level training. This can require years. And 5, implants are not like real teeth. They don't have a ligament around them like a real tooth. They don't have the ability to absorb the types of forces in the same manner as real teeth. They also require special methods for cleaning them and maintaining their health. Well, that really concludes our 5 things you should know about X. Today, X was implants, and I really want to thank Dr. Juan P. Anfrance. You have that little name with the hyphen at the end of it.
I added the hyphen.
That's pretty cool. And I want to thank you for your expertise. It's certainly a pleasure to work with you as a colleague and as a friend. And thanks for joining us today.
Thank you.
All right, everyone. Next time, we'll have a very exciting X topic for you.